I think you should be in seat. All right, everyone, come on in and please have a seat. If I could have the faculty please come up onto the stage. All right, are all of our students present and accounted for? Looks like every seat is full. So everyone else, please funnel in and have a seat. We're going to start here in just a minute. All right, everybody, thank you so much for coming. Welcome, welcome, welcome. Especially to all the beautiful students. It's so nice to see you guys all showered and with brushed hair and brushed teeth, not a pair of yoga pants in the house. I'd have to tell you guys, I think these white coats are gonna look really nice. These crisp white, new white coats that we have over here are gonna look really nice on you guys. And I'm excited to see them on you here in just a few minutes. As we have the last few folks funnel in, I just want to say welcome to the parents, to the family members, to the significant others of our students here today. We're so glad you guys could come. But speaking of the white coats, I want to tell you something. A year from now, I think those white coats are going to look a lot different, right? They might look different, but that's good because the condition of your white coat at the end of this year will give you an idea of how much blood, sweat, and tears have been poured into your clinical year. What an honor it is for me to be among the first to say congratulations to you guys and job well done. We come together today to mark an important event in your education. The good news is that the problems, headaches, and stressful events of the didactic portion of your PA education are over. The bad news is that there's going to be a whole new set of problems, headaches, and stressful events to come. But the big but is that there will be a different set of problems. The weeks with multiple exams in a row and the 8-hour learning marathon sessions of studying are over. Let me say that again so the PTSD in you can start to heal. The weeks with 2 to 3 exams in a row and 8-hour learning sessions in the classroom are over. So what's in store? Well, let me tell you something about the lessons I learned during my clinical year in PA school 24 years ago. I learned that despite everything I knew about sterile technique, I would get kicked out of an operating room for dropping my hands below my waist by a mean OR nurse, but only once. I would learn that I would overcome my fear of presenting on surgery grand rounds by the 4th week of the surgery rotation, but unfortunately my surgery rotation only lasted 4 weeks. Another unfortunate pearl that I picked up during that rotation was that high anxiety situations caused me to have extreme gastric distress. I got real familiar with the closest bathrooms. I learned that I like soul food when Dr. Albert Thomas, my family medicine preceptor, took me every day of my rotation to lunch to a restaurant called the Tiny Diney, where the restaurant owner gave Dr. Thomas a free meal every day for lunch for taking such good care of his family. Dr. Thomas was the first Black surgeon to get privileges at the Mobile Infirmary, the oldest hospital in Mobile, Alabama. Among other things that I learned from Dr. Thomas was resilience, grit, integrity, and compassion. I learned that though I could read ECGs well enough to answer test questions when it came to my first real patient in a nursing home with gigantic ST elevations in the inferior leads, somehow I couldn't recognize a myocardial infarction if it smacked me in the face. But through all these trials and tribulations, I learned that I did indeed have the skills to function as a second-year PA student within the confines of the clinical setting, and more importantly, I began to develop confidence in myself as a clinician. One of the great joys of myself as an educator is seeing my students develop the same confidence, and I look forward to seeing that in you. You see, over the next year, you will develop something I like to call graduated autonomy. Over the span of your rotations, you will go from someone literally standing over your shoulder watching everything you do to the point where they may say something like, hey you, go into room 2 and suture up that guy. I'll be in 10 minutes to check on you. To this point, how cool is it that the things you're going to be doing on the last day of your clinical rotation are going to look remarkably similar to the things that you will be doing on your first day in your new job as a PAC? But guess what? Then you'll get paid for it. So despite the long hours, the overnight calls, the early morning rounds, and the end of rotation exams, this year is where the magic happens. I ask that you indulge me as I share a few pieces of advice for your clinical year. First of all, be an ambassador of the PA profession. Unfortunately, despite how long we have been around, not everyone knows who we are, what we do, and what we can add to the healthcare team. Go out of your way to be a good ambassador. This is how you pay it forward to those PAs who come behind you. Next, don't be afraid to be wrong. Within the context of the pervasive Socratic method of medical education, you will be given numerous opportunities to share your knowledge. Don't be afraid to speak up on rounds or ask your preceptor when you have questions. There will be times when you are right and times when you are wrong. The times when I was wrong in my clinical rotations were the times that I learned the most. It may not always feel like it, but you are in a safe environment. It's okay to not know everything. And when you are right, feel free to silently and mentally high-five yourself. Remember that your patient is not a disease or an injury, but a human being with feelings, emotions, loved ones, and life outside of whatever clinic or hospital you're seeing them in. You might be seeing them on one of the worst days of their lives. Treat them with kindness and compassion, even when it's hard. So, as it turns out, I actually have a lot more advice, but I'll hold off for now. And what do you say we meet back here in a little over a year, and we'll do this again, and then you can wear your long white coats. So thank you for indulging me, and congratulations and best of luck to you all. And now I have the honor and pleasure of introducing Dr. Claire Mulry, who is the Acting Associate Dean of Health Professions and Human Services.
I'm a little shorter than Dr. Gillum. Good morning, everybody. Thank you for having me here. Dr. Gillum, thank you for your welcoming remarks and leading this wonderful ceremony. Thank you also for your leadership as the director of the PA program and for the culture of excellence you're inspiring. Appreciate that. To the faculty and staff, thank you for preparing and delivering the curriculum that prepared these students for this clinical experience, and also for providing our students with a world-class medical education. Also, thank you for Joanne and others for organizing this wonderful event that everybody can stay in. And thank you all for supporting these students and being a member of training the future generation of medical healthcare providers. Family and friends, thank you. You've held these students up to get them to this point. Thank you for your confidence, for visiting us today on campus as we recognize and celebrate the year of studying, hard work, blood, sweat, and tears shared by these amazing students. Thank you for your support of them. Students, congratulations. Today's an important milestone as you stand at the midway of your education, your PA education, and on the threshold of clinical practice. It's an exciting time. Anyone here excited? Anyone nervous? Yeah, that was a little stronger, right? Little nervous. Your nerves, are they today compared to when you did your simulations a couple weeks ago? Where are the nerves? They're there. Although I'm not a PA, I can absolutely, I'm an occupational therapist, and I can really understand the nerves of this. Nerves are good. Nerves tell you that you're taking this seriously. Not all that long ago, or maybe 30 years ago, I started my clinical rotations in occupational therapy. And my first day, I'm all excited. I got my white coat. I got my Littmann stethoscope. Anyone have a Littmann stethoscope? Yeah, I had my stethoscope. My first job on the acute brain trauma unit was to take go with a PT and help a gentleman who'd been in a coma for months sit up and see if his cardiovascular system could manage the change in posture. And I had to take that blood pressure. Anyone take a blood pressure and all you can hear is your own heartbeat in your ears? That's where I was. I took it 3 times with another clinician in the room, and I heard nothing. Nothing. And I had a moment to decide, do I make this up? Or do I tell the truth and ask for help? You're going to be in that space a lot. I turned and I said, I can't hear anything. I need some help, because I knew it was critical that the information be accurate. And I needed to say, hey, I need some help here. Turns out, y'all, who has a Littmann? Anybody? You know how you turn the bell? Yeah, maybe I hadn't turned it on. And so the physical therapist I was co-treating with came over, took the Littmann, and then handed it back to me and said, well, why don't you try again? So I was mortified, but that was the worst thing that happened. I asked for help, I've got it, and I got a story that reminds me that I need to be humble and ask for help when I need it. So that was mine. Believe it or not, nerves are good. You just need to control them. It shows that you're taking the next phase of this education seriously. We've all been where you stand now, and we each have our stories to tell. How you meet this moment, however, is important. As you head out to your clinical sites, it's important that you recognize that you're PA professionals and you want to do your profession. You're also ambassadors of Kean University, and we appreciate if you'd act accordingly to let people know what a great program Kean has. It means, what does it mean for you? It means at this point, you're going to be taking responsibility and initiative for your learning as you're out there. The professional oath that you are going to take today highlights empathy and compassion. Seek to cultivate them both in abundance as you commit to lifelong learning, to always strive to enhance your process. If you'll indulge me, I too have some suggestions as you go forth from here. One is be prepared. You've been prepared didactically, but you're going to have to now go out and apply it in real clinical situations and apply the knowledge that you've gained. Don't be afraid to share your knowledge. Don't be afraid to speak up and ask questions. The second thing I would say is be present. Don't worry about what's going to happen, but be where your feet are 100% of the time, in the setting with your client in front of you. Hear their story and keep forward what you're asked, forefront in your mind what you're being asked to do. Don't let the worry about what the future might hold rob you of the present learning experience and how it will help your development. Be open to learning. You're not expected to be perfect nor to know anything at this stage, everything. You are expected to know some things. Excuse the paraphrasing error. You are expected to be engaged and to demonstrate initiative. One of the hardest things I had to do at the clinical stage is being open to feedback. It's hard to have someone in those early stages watch your every move and give you feedback. If you see it not as an indictment of you, but as area for growth, it will serve you very well. So remember, try not to be defensive and hear the other perspectives of how someone else might have done what you just tried to do. This is a hard one, but don't compare yourself to others. This is about your learning. This is about your growth and your professional development. Each one of you is in a different space and a different place in different areas. So please don't compare yourself to others. Examine your growth and what you're doing, what your areas are for development. Please be mindful. My professional reasoning and development is dependent upon reflection. How many of you got through that test and were like, that's over, put that away? It's important in your clinical practice that that's not, oh, I got through it, good, I'm done. No, I got through it. What went well? What did I do well on? What didn't go well? How did the rapport with the client go? After each encounter, reflect. What can be enhanced? What went well? What did you learn? This reflection is vital for your professional development, and it's something you'll need to cultivate when you're out there. I assure you, you will learn much more from your errors than your successes. Please maintain a focus and a humility that will serve you well throughout your career and make you truly excellent healthcare providers. So before we give you these wise clothes, on behalf of the faculty of the College of Health Professions and Human Services, we are very happy for you. We are very proud of you. Congratulations. We know that you'll pass your clinical rotations and that you will thrive in amazing careers as physician's assistants. Congratulations.
Thank you very much, Dr. Mori. And now I would like to ask Dr. Michael Tehan, one of our didactic faculty, to come up to give us our keynote address.
All right, so good morning, everyone. I just want to say thank you for coming, faculty, family, friends, and most importantly, the Kean University Physician Assistant Class of 2027. Today isn't just a ceremony, it's a milestone. The moment when the classroom begins to fade into the background and the clinic starts to come into view. You spent the past year immersed in anatomy, pharmacology, patient care, and clinical medicine, navigating caffeine-fueled nights, endless exams, and probably more acronyms than any human should ever be expected to remember. And yet, here you are. You made it. What you've accomplished over the past year goes far beyond textbooks and exams. The sacrifices you made, missed holidays, postponed vacations, skipped family gatherings, are things most people can't even imagine. You pushed through sleepless nights, quiet moments of self-doubt, and the feeling that the world might just be burning down around you. And through it all, you persevered. You showed up, you adapted, you found strength in each other, and drive in the dream that brought you here. That kind of commitment, the willingness to keep moving forward even when no one is watching, is what will define you in medicine far more than any test ever could. To the parents, families, and loved ones here today, thank you. You were the steady voices on the other end of those panic-stricken, late-night pre-exam phone calls, the ones who listened when all seemed lost, who reminded these students that they could do this, even when they doubted it themselves. Today isn't just their milestone, it's yours as well. This short white coat you're about to receive represents more than just a piece of fabric. It's a symbol of your transformation. A year ago, you were students learning about disease. Today, you begin learning from it. Through your patients, your mentors, and your own mistakes and triumphs. You'll soon discover the clinic isn't always clean or predictable. You'll meet patients who test your patience, challenge your knowledge, and sometimes break your heart. But you'll also witness the best of humanity, the gratitude of someone who finally feels heard, the relief in a patient's eyes when you explain something clearly, and the quiet strength of a team working together to save a life. Medicine at its core is not about perfection. It's about presence. It's about showing up every single day with curiosity, humility, and empathy. The best PAs are not those who know every answer, but those who know how to listen to their patients, to their colleagues, and to themselves. As you put on your white coat, remember that it doesn't make you infallible. It makes you accountable to the trust your patients place in you and to the privilege of being part of their stories. You are stepping into a lineage of healers, thinkers, and advocates who understand that medicine is as much an art as it is a science. In a few short days, Monday, you'll be standing in hospital hallways, clinic rooms, and ERs. You'll feel nervous, excited, maybe even terrified. That's okay. Every great clinician starts with a mix of confidence and doubt. The key is to let your doubt keep you humble and your confidence to keep you moving forward. The lessons ahead won't come from textbooks or slides, but from the patients who trust you, the mentors who challenge you, and the moments that reveal what kind of clinician and person you are becoming. So today, celebrate this moment. You've earned it. But remember, this isn't the finish line. It's the beginning of something real. Congratulations, class of 2027. You are ready.
All right, thank you, Dr. Tehan. So now the moment that we have all been waiting for. If I could call Professor Amanda Ahern up here, the newest member of our faculty. Let's begin the coding of the white coats.
Good morning. Good morning. Good morning. I'm so excited to do this. I remember these little baby students on their first day of derm with me, so full circle. So let's get started. We're going to start with Professor Kyle. All right. All right, this is Julia Astrom. We have Emma Beamer next. Michael Duca. Anthony Geronimo. Next is Krista Leonardo. Lamisha Prova. Mariam Sadrak. And last but not least, for Professor Kyle, we have Kaylee Waldman. Up next, we have Professor Dr. T. Hanscrew. First, we have Michaela Desai. Next, we have Michaela Gregada. Ryan Hochstetter. Next up, we have Allison La Rochelle. Next, we have Jack Miles. Next, we have Kayla Kispalaya. Next up, we have Kylie Rossler. Last but not least, we have Navenga Vallejo Lasong. Next, we have Professor Disla's group. First, we have Hannah Duque. Next, we have Mary Kate Huth. June Kim is next. Next is Christina Crabiel. Mallory Meehan. Priya Mistry. Next is Jessica Singh. Last but not least, we have Francesca Tagliaferri. And that is everyone's white coat.
All right, thank you so much. What exciting day this is. So next, I would like to have the class of 2027 please stand up. And I would also welcome anyone else in the room who's a clinician to stand up and follow along. And we're going to cite the PA professional oath together. So you'll just follow along with me. All right, everybody found it? Here we go. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-malfeasance, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will care and share and expand the knowledge within the profession. These duties are pledged with sincerity and upon my honor. Thank you. All right, so let's have a big round of applause for the class of 2027. Congratulations. All right, you may be seated. I have a couple of things I want to say. We're actually done with the ceremony, but I have a couple of things. First of all, can you guys stand up one more time? Stand up one more time. And I want you to turn around, and I want you to face the people who came with you, and I want you to give them a big round of applause. All right, now I want you to turn to the corner over here, and we're going to give Joanne Pabuda a big round of applause. All right, now, the next thing, you guys can sit down, and I would like, at this time, if we could have all of the family members and friends and supporters please exit back out. We'd like to have you guys step out because we're going to just take a few minutes and get some great photographs of the class of 2027 up on the stage. So the photographer, that'll take just a few minutes, and then I promise your PA student will be out to join you in just a few minutes. So if everyone else could just step outside, grab some coffee or bagels, and we'll be out to join you in just a minute.